If mental health was not in this school, I swear to God I wouldn't be existing. I think I would be dead.
Across many high schools in Uganda, mental health challenges among teenagers remain covered in silence, stigma, and harsh disciplinary policies. Mubiru Erisa, a student of Mount of Olives College, Kakiri, represents a quiet shift.
I had thoughts of suicide. I was in senior 2. I attempted to do it, but there I talked to a mental health champion. I opened up. I felt like I had a big mountain on my head, but I shared it and they said that it's okay not to be okay.
And most times you know how someone behaves. You can approach them, and if they do accept to talk to you, you listen to them. That is a second elderly telling you is above your grounds. You can do nothing to help them. Then you link them to maybe the vocal teachers, you link them to the mental health toll-free line, you link them to the mental champions. They can tell you about what's disturbing them, and then when you analyze what their problem is, try to help them find a solution. Do not give them a solution. They just guide them to find their own solution.
Implemented across 8 pilot schools in Wakiso and Gulu districts, the initiative trains 12 peer champions per school, driven by Mental Health Uganda and SOS Children's Village. By leveraging lived experiences and low-cost toolkits, the model brings psychological first aid straight to the school classroom.
I have been using a social contact model. A social contact model, that is where we normalize the conversation. If it's okay not to be okay in line of mental health.
School administrators note a tangible shift in school climate.
It is easier to teach a happy child. So in view of that, when these people of Mental Health Uganda came here and asked for permission to run a program here, I very willingly took on the program.
Here at Mount of Olives, what we did, we ensured that each class at least had one person. So currently we have 30 students. They have their chairperson, the secretary, yes.
The mental health program does not occur during class time, so it does not interfere with academics. It is done after class and during the weekend. And the training of the mental health peers is done during holidays.
Instead of sending struggling students straight to disciplinary panels or to high suspension rates, teachers now use counseling approaches.
They had to first bring me some of the cases, and you find that at the end of the day, even the levels of suspensions and expulsions come down. This didn't only end on the students, even the teachers were trained.
Yet public accountability remains lagging. On September 29, 2022, the Ministry of Education issued Circular Number 20, directing all schools to dedicate 1 hour weekly to counseling and allocate 1% of institutional budgets to mental health. 4 years later, government funding remains virtually non-existent, leaving schools reliant on temporary grants.
The richest problem is that many things happen on paper, but on ground they are what? They're not there. So this is why we end up having these different organizations coming up to help, to be there, to make sure that, otherwise the government is not doing enough to make sure that ability. And I appeal to the government that that budget about mental health, regarding mental health, is not enough. Otherwise we shall keep losing economically, socially, to things that we don't take care of or give so much weight.
If I die, I'll make those people hurt and they will miss me. And I feel like I matter a lot. And why don't people see that? I think they will see it when I'm gone. There, I talked to a mental health champion.
Erisa's realization that his life matters is the true measure of what is at stake. While Circular number 20 proves that the government recognizes the crisis on paper, making those words a reality in every classroom will require real funding, ensuring no student is left to suffer in silence.